Prevention of novel coronavirus pneumonia. First of all, what's coronavirus? Coronavirus is a kind of virus widely existing in nature. The virus is named because it is similar to a crown when observed under the electron microscope. So far, coronavirus only affects vertebrates, which can cause respiratory, digestive, and nervous system disease in humans and animals. What are the clinical symptoms of novel coronavirus patients? The general symptoms include fever, fatigue, and dry cough. For some patients, the symptoms are so slight that they may even not have fever. For patients with severe condition, they may have acute respiratory distress syndrome, septic shock, metabolic acidosis that is difficult to correct, and coagulation dysfunction. For most patients, the illness condition is moderate, and they have a good prognosis. For only a few patients, the conditions are so severe that it may lead to death. What are close contacts? First, people who live, study, work, or have close contact with a confirmed case, or other close contacts. Second, medical and the nursing staff and the family members living with them, who treated, nursed, or visited the confirmed case, or other personnel who have a similar close contact with the case. Third, other patients or caregivers in the same ward with the case. Fourth, people who have close contact with patients in the same transport vehicle. Fifth, other circumstances considered to be close contacted with a person with close contact with the patients by the professional investigation and evaluation. If someone is diagnosed or suspected to be infected, please don't be panicked, don't go out at will. Do a good job of self-physical condition observation. If you have fever and cough, report to the local CDC in time, or go to the designated fever clinic for checkups and diagnosis. At the time of medical treatment, you and your family should do a good job of protection to avoid cross-infection. How to reduce the risk of infection? First, wash hands frequently using flowing water and soap. Second, wear masks when going out. Third, cover your nose and mouth with tissue or a flexed elbow when coughing or sneezing. Fourth, avoid close contact with anyone who has flu or cold-like symptoms. Fifth, try to avoid going to crowded places. Sixth, pay attention to food safety and thoroughly boil meat and eggs. Seventh, avoid contact with wild or cultured animals without protection. How to wear the mask correctly? Wearing a mask is an effective way to block the transmission of respiratory secretions. Wash your hands before wearing the mask, or try to avoid touching the inside of the mask during wearing, so as to reduce possibility of the mask being polluted. When wearing disposable medical mask, the metallic strip makes the nose clip face outward. Extend the mask to fully cover mouth, nose, and chin. Move the metallic strip over nose bridge to make the mask face snugly over the face. When wearing the protective mask, hold the mask with one hand. Face up the side with nose clip. Then cover the mouth, nose, and chin of the protective mask and press it up tightly to the face. Use another hand to pull the over tether over the head. Put it under the back 2 ears of the neck. Pull the upper tether over the head. Put it in the middle of the upper head of the ear, and then compact the nose clip to make it close to the face. Finally, cover the mask and blow. Check whether there is air flow through the 2 ears and nose clips. If not, it means that the mask is worn correctly. How to wash hands effectively to avoid infection. Wash hands before meals, after defecation, after going home, touching garbage, touching animals, touching public doorknobs and other objects that many people touch. When washing hands, use flowing water, soap, or hand sanitizers, and knead for no less than 5 seconds. Wash your hands and apply enough hand sanitizer to your hands. The first step is to rub hands palm to palm. The second step is to rub right palm over left dorsum with interlaced fingers and vice versa. The third step, palm to palm with fingers interlaced. The fourth step is to rub the back of the fingers to opposing palms with fingers interlocked. The fifth step, rotational rubbing of left thumb clasped in right palm and vice versa. The sixth step, rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Finally, clean your wrist alternately. When the disease comes, don't panic. Study the prevention knowledge carefully and everyone do the best to protect. Let's unite to fight the disease. How to wash hands effectively to avoid infection. Wash hands before meals, after defecation, after going home, touching garbage, touching animals, touching public doorknobs and other objects that many people touch. When washing hands, use flowing water, soap, or hand sanitizer, and knead for no less than 5 seconds. Wet your hands and apply enough hand sanitizer to your hands. The first step is to rub hands palm to palm. The second step is to rub right palm over left dorsum with interlaced fingers and vice versa. The third step, palm to palm with fingers interlaced. The fourth step is to rub the back of the fingers to opposing palms with fingers interlocked. The fifth step, rotational rubbing of left thumb clasped in right palm and vice versa. The sixth step, rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Finally, clean your wrist alternately. When the disease comes, don't panic. Study the prevention knowledge carefully, and everyone do the best to protect. Let's unite to fight the disease.